Within a 5 or 6 minute walk from our Midtown campus, there are over 500 residents who live either at or below the poverty line, and many of these families don't have medical insurance.
How can we stay silent when the noise of praise has gone?
We read in Acts 3 of a time when the Apostle Peter was asked by a man for money who was crippled from birth. And this man's highest expectation was to receive money from God's people. Peter didn't walk away in disgust or pass by this man or turn away from him in fear like you and I might do. He looked at the man and he said to him, "Look at me. Silver and gold I do not have to give you, but what I do have, I give you." And he introduced this man to Jesus. Peter shifted the man's focus off of his worldly need, and by faith, this man turned to Jesus and he was healed. He got up off of his mat and he left and he walked, rejoicing and praising God. This man received something far greater than what money could ever purchase. Over the last several years, we've had many conversations with residents. They haven't been able to go to the doctor when their children are sick. They haven't been able to get the medical care that they need. And they have come asking us, is there anything that we can do as a church, as the people of God, to address the physical medical needs of the people in this city? When a guest first arrives at a Sojourn Medical Clinic, they're immediately welcomed and paired with a Sojourn advocate. Someone from Sojourn who is just going to walk alongside this guest for the remainder of the clinic. The advocate's goal is just to get to know the family from the neighborhood, to share stories and get to know their story so that we might establish a loving and really rich relationship with those who are coming to receive medical attention and care. After each guest gets evaluated by a nurse, they have an opportunity to be further evaluated by a doctor or a dentist or a physical therapist, cancer screening, American Red Cross to give blood if that's something that they desire to do. We transformed our gymnasium into a family dining room where every guest was able to eat a warm meal with their family advocate. We were just able to eat as a family, be welcoming as a family, enjoy time with one another. Our guests then went to a family services room where we had the ability to give them free clothing and free groceries and toiletries and free Bibles and reading literature so that they might learn more about who Sojourn Community Church is. And it was our hope to host a medical clinic where we could pull together the people and the resources of God so that we might give back to this community and provide for them not only physical medical attention, but do so in a way that points them to the greater physician that we have in Christ Jesus.